Hi everyone. So this is a new study which discusses once weekly semaglutide in adults with overweight or obesity. So semaglutide is basically originally an anti-diabetic drug. It is a glucagon-like peptide 1 analog and was initially FDA approved to treat type 2 diabetes. But over the years, it was found that it is also useful for weight loss. So this study was done. So there were 1961 participants in this study who received 2.4 milligram of subcutaneous semaglutide, and the dose was increased gradually. So you can see here, so the dose was started and then gradually increased to 2.4, and placebo was also given, and you can see the results here. Just let me zoom a bit. Yeah, so you can see the change in baseline weight. So this is the placebo curve and this is the curve for people who took semaglutide. So you can see there's so much change in the weight from the baseline. This is at 4 weeks, 8 weeks, 12 weeks. So as long as the person has been taking semaglutide, the weight has been lost. So by week 68, mean weight declined more with semaglutide than with placebo, 14.9%. You can see 14.9% at the end, with estimated difference of minus 12.4 percent points. So I'll just draw it so you can see more clearly. Yeah, so this is the final, somewhere around here, 14.9, and with placebo this much only. So you can see that semaglutide is very useful for weight loss as shown in this study. The adverse effects are mainly gastrointestinal, were most often mild to moderate, and only 7% of the people who took semaglutide discontinued the drug. Even the people who took placebo, 3.1% of them discontinued it. Serious adverse events which are very rare are hepatobiliary and primary gastrointestinal. But there are some very important things which one need to keep in mind. The study was done on mainly female white people, so the effect of drug might be different in different ethnicities and the people who differ from the participant population. And secondly, 43.7% of the participants had pre-diabetes. So the change in weight might differ according to your own clinical condition. And keep in mind, clinical guidelines suggest pharmacologic interventions in addition to diet and exercise to promote weight loss among adults with BMI of greater than 30 or 27 in those with coexisting conditions such as diabetes. So there are some barriers to the use of this medicine, such as adverse effects and mainly cost. There is another medication similar to semaglutide, which is also a GLP-1 analog, liraglutide, which is also used in diabetes. But the effect of liraglutide on weight loss is not as strong as compared to semaglutide. And so the mechanism of action of semaglutide for diabetes is it increases postprandial, which is when after eating food it increases insulin secretion, reduces glucagon secretion and delays gastric emptying. But for obesity it works mainly by reducing hunger through your brain. So, and keep in mind that this study was done uh, in participants uh, without diabetes. So, semaglutide was given to participants without diabetes, and lifestyle changes were also uh, used, as you can see in the chart. Lifestyle intervention were also used because all the guidelines recommend lifestyle changes accord along with the medications. I'll provide the link for the research in the description if you're interested to read in detail.